I'm done. Okay. Okay, we'll try again. Okay, we're having some problems on our end, trying to figure out why we are getting this feedback. But it is 12 noon, and we will call this meeting to order. Josephine, roll call, please.
Roll call. Okay. Poki Balas, absent. Beverly Gotelli,
Here.
Louise Johnson,
Here.
William Kinaka,
Here.
Stephen Long,
Here.
Sarah Lancer Medeiros,
Here.
Shelley Ogata,
Here.
Susie Sober, Marilyn Seeley,
Here.
Barbara Sturvis, Gary Simon. I
Here.
saw him sign in. Yes, thank you. Lisa Spencer,
Here.
Rick Tabor,
Here.
Charlene Taketa, Leslie Tanoy.
Here.
Thank you. Raylene Teno.
Here.
Okay, wow, we have almost perfect.
Thank you, Josephine, and thank
12
you,
members.
Very good, thank you, Josephine.
Okay.
And thank you everyone for being here. Going on with the agenda, you received the draft minutes of July 11th, 2025. May I have a motion to accept the minutes?
Motion.
Okay, moved by Rick Tabor, seconded by Raylene. Open for discussion. Are there any additions, corrections to the minutes of July 11th? I mean, you know, many eyes, sometimes people get something that we didn't catch, so. Anybody on screen? Do we have any corrections, additions? Okay, seeing none, hearing none. All those in favor of accepting the minutes without objection, say aye.
Aye.
Okay, thank you. Opposed, nay? There are none. Thank you. You have adopted the minutes. Going on to the executive director's report. Sandra?
Yeah, thank you. Well, hi, everyone. Aloha. Can everyone on Zoom hear me okay? Just give me a thumbs up. Thanks, Susie. Okay, good afternoon now, but I just wanted to go over, you have the agenda, just some of the updates on our federal landscape. As we know, and we keep continuing to hear. Bill, give me a hand up. Oh, you can hear me. Good. You can hear me, Bill? Anyway, Bill can hear me. Okay, the Administration for Community Living, there is still discussions that this is going to move to the Administration for Administration for Children, Families and Communities. As of Monday, July 14th, there was a federal reduction in force, had been implemented. So all the regional offices were closed. There was cuts to the budget and grants team. There was cuts to the policy and evaluation team and the majority of the communication staff at the Administration for Community Living. So a lot of changes going on. We're going to see how that plays out as far as communications, grant notice awards coming down to EOA, but we're just waiting and see how that's going to impact us at the state level, which will eventually roll down to our county levels also. So probably have more to share in the next month or two as we go into a new federal fiscal year, but just wanted to share that. The Older Americans, good news is that the Older Americans Act funding is intact based on the 2024 budget. So that is good news. The current proposal from the president for the 26 budget is to have level funding as of 2024. So we haven't had cuts. People, this is a good thing. There's so many other things being cut. So we are grateful for that. And as far as our landscape, we're still watching to try to see how on the Medicaid side and all of our other safety net programs, how those things are all going to play out. So something very important that we want to watch for. Older American Act reauthorization. I may not have touched on this much in our previous meetings, but, you do know that the act expired in 2024, and during the last, when Congress was in session prior to the change in administration, they were so close to passing the Older Americans Act. But there's just a little hang up, not sure the details of it, but didn't get passed. But there seems to be bipartisan support for the Senate proposal, I believe, of the Older Americans Act. So they're pushing for that to get reauthorized. So we're just waiting to see what happens on that front. So, just waiting, again, a lot of wait and sees, but just really trying to keep a pulse on what's going on and the changing tides as we navigate both these oceans. I did,
Getting seasick.
I am, no, I'm getting
I'm
seasick.
seasick. I'm seasick watching the news.
Yeah, but, good news is that, Wells Sky had hosted a presentation about the Older Americans Act and the current implications, and it was done by Kathy Greenlee, who we all know used to be, she was the first administrator for ACL. And it was really a real good presentation, and she presented, because we've been scared, what does this mean if ACL gets moved under administration for children and family, and then communities as they change it to communities. We thought, what does this really entail? And she said, if it has to move, this would be the best move. That was very reassuring to hear. So, and she comes with all that institutional knowledge, right? So, it's not like you take it with a grain of salt. She's coming with authority and knowledge. So that was really, really good to hear. Yesterday we had to say goodbye to a retiree, Lindy Itani, with our long-term care volunteer program, the long-term care ombudsman volunteer program coordinator. She retired with 30 years of service, John?
30 years of
Yep, and they just honored her at the Capitol on, Department of Health had their recognition day, this past Tuesday, and they honored 30, 40, 50 years, and then the awards for best manager, best team, all that kind of good feel stuff. So she was one of many 30-year employees that got honored. So we're happy for her. We're sad for us. We're sad for us. We're happy for her. I'm a little jealous too. Some of us that are getting up to retirement age. Let's see, what are some of my other things? Open enrollment's coming up for State Health Insurance Assistance Program for Medicare, so they are this early part going into open enrollment that starts in October is all the prep work, making sure the counselors are certified, trained up, ready to go when that happens. I mean, we've seen just increases over the last few years where we're going from within a 1-year time frame, we went from 9,000 contacts to 12,000.
Wow.
And remember, this is with literally 2 staff and a slew of volunteers. So, they're doing a lot of good work, and we're going to continue to support them. Looking forward to eventually getting the positions that are vacant filled and the new ones that are coming, the state funded ones on board, that we can get those filled too. And the last thing I have is good news. Our launch of our Alzheimer's disease related dementias campaign is going live next week, Monday. That's why Connie's not here. She's just doing a lot last minute fixes for some things, just to make sure everything's good for Monday. And just please, we're expecting between the multimedia blast that's going out is about from August till the end of November, 49 million impressions.
Wow.
Through TV, radio, print, Spotify, I don't know what that is, but Connie's on the. So you can see I'm aging. There's all these different platforms that it's gonna be going out on. It's pretty comprehensive what they're doing. And so we have a lot of social media, we have 4 different social media spots, 15-second commercial, 30-second commercial. I was gonna give you guys a preview, but I'm just gonna text you guys as if finding it when it comes out. So, and you know what, maybe the next meeting I'll bring it up.
Okay.
Because some people may not have seen it by then, but with 49 million impressions coming out, I'm hoping that this will be something you either hear while you're driving, delivering meals, or something that you see.
Spotify one.
'Cause I've never been on it, but I've heard about it, I've never been on it. Show the Spotify one.
Well, no, it's what it is, it's these commercials and all the social medias that you're going to see throughout all these different media platforms, yeah. So, we're excited, we're gonna be tracking the analytics and all of that and the feeding to the website. And as you know, this is to really impress upon people to get that early detection. Make sure that you're educated because that way with the new where it's going with some of the medications that may be available, if you have that early detection, if you can, you're not gonna prevent it, but if you can slow the progression, it would be really, really good. I got it right? Yep, okay,
When we go live?
Any
Monday.
Monday. All right.
Any questions for the director?
Yeah, sorry, it was a little long report, I just wanted to share that.
When you talked about the administration for community living and the RIF.
Mhm.
So the RIF, the budget and grants team,
I'm not sure it's portions of it,
Oh,
I think,
portions.
yeah, it's not like the whole,
elimination of,
that may be true. I'm so sorry. Let me go back and double check my report. but-
I mean, but then how does the money get out?
Yeah, that's my concern, Shelley. I think they have a little clue, I'm just surmising right now. Because we have been getting some of our grant awards, like we got word on the ship one and the SMP, so we're happy, those awards have come in, so there's someone over there doing the work. But I'm not, it's not at the level of a place, so.
Okay.
Yeah, so, just holding. No, we're
The
trying
fact
to.
that they don't put the word aging in there is very telling.
Can I respond to that? Okay,
Very telling.
what, Kathy Greenlee said is, she goes, do families not have grandparents and great grandparents? We're all part of a family, so when she
So
said
are the
it that way-
children.
So are the children, but
But they're caught up.
that's true, but I think we actually have a recording, you have to see her presentation now.
You're trying to be positive.
Yes, I'm trying to be positive. As we move forward.
And I'm just recognizing age isn't in there.
Okay, thank you very much. Anybody on screen have
Any
a question?
questions? We have any questions
Okay,
online?
No, I don't see any. Okay, moving on.
Oh, one question.
Oh, sorry,
Oh,
yes,
yes,
Mr. Bill?
What impact, if any, on your staff right now?
My staff, the budget's intact, so my staff are intact. Good.
Back
You're
to
not, got
hiring.
nothing.
There's no federal funding cuts, if that's what you're asking.
Well, I'm just
So-
wondering, you have any kind of orders from the governor or somebody else to cut staff or something like that?
No, we're good.
About hiring
good.
Carolina,
Yeah,
how many vacancies in her house?
sorry, I didn't put it in my report, so I don't, yeah, but I'll share with you later.
Thank
We're
you.
getting there.
Okay, chair's report, I did talk with the director several times over the upcoming agenda and other matters that will be brought up in today's meeting. It's an ongoing kind of communication between the two of us. It's either a phone call or an email that gets done. And I think the biggest concern between the two of us is making sure that the agenda is done in a timely fashion. Okay, just to keep in touch with Sunshine Law to make sure that we are in compliance with everything that goes on there. Okay, that I think is the most trying of everything else, is making sure we keep those timelines in place, okay? Rick, Legislative Committee,
Okay, so we met this morning, had a good meeting, went over expectations, covered quite a bit of that stuff we talked about and. We'll bring it up a little bit, having different presenters come. So we'd like to have each of our monthly meeting have a 15-minute presentation from someone that's connected to a bill that we, as the BIA, choose to support. And we'd like to open it up that anybody that wants to join us to those meetings to hear can. If there's something that really pertains more, not necessarily to a bill, but more to the BIA as a whole, then those presentations will go that direction. So in keeping to trying to get the agenda together, just letting myself, Beverly and Christina know far in advance what you'd like to have on the agenda. So we don't have last second things being added, because we can't. So the other thing we talked about is bills that did not pass. We talked about bills that passed a little bit. We just kind of skimmed over that. But more about the bills that didn't pass and whether we're gonna kind of look at supporting those again going forward. We'll bring that here once in December. We'll vote on that in December, but we've already started assigning people to the different bills. Like, of course, I'll continue to follow the hearing aid bills and Alzheimer's stuff. Gary's got the usual ARP stuff that he'll cover. So we're gonna stick with the same, and we got a lot of new members, so we're gonna be able to cover a lot more. And then, I'll just say, in October, we're gonna have a PAR thing, gonna be imperative for people to come and join that, so you know how to look stuff up. Christina does a great job of getting us information, and I'm telling you, that's remarkable. But being able to get in there at PAR is also important. Last thing I'll say, and I'll stop. Even if you're not the lead for a bill, we would like testimonies from everyone. And there's a preamble that we actually use for that, as long as we're supporting that bill. If it's something that we didn't support as Pavia, but you have a passion for that, you can still do that as an individual. And then we're well aware that actually going live for a testimony or even Zooming is even more powerful than your written testimony. So there, it's all important, but the more testimony we get on a bill, the better, especially if there's money attached to it. That was some of our discussion this morning. I'll stop there. It was a 90-minute
That's very
meeting.
good.
It was good
Thank
though.
you.
Yeah, good team.
Thank you.
So,
Okay, Lisa? Oh, I'm sorry, any questions for Ledge? Going on?
well,
Sorry.
I mean, we'll always meet on the Pavia day at 9:30 here. So 9:30 till 11 is our meeting time, and it's hybrid, so. Okay.
Going on, Plans and Projects Review Committee, Lisa?
Hi, thank you. Our committee continues to work on our proposed AAA report template for PABIA. We are going to be asking for some feedback from the AAA directors, so I will be sending out our draft for your input. One of our committee members said that it was important that we tell you why we're doing this. So we wanted to try and make a consistent template or framework that all of the AAAs can use for their reporting. It's gonna help you folks in the sense that, you know, you only have to put in specific information. We've put the basic information in for you already, but it's also going to help us at PPRC to kind of keep track of what kind of programming is happening on the or within the different areas. And we want to make sure that all of the projects that are happening through PABIA is really, or through the AAAs, are really related to the goals of PABIA. And so we're thinking that this is going to help us. So I will be sending out the proposed template to the 4 areas, and you folks can go ahead and look over it and send your feedback back to us. I want to thank Emily because we are using Kauai's template or report as our template. So we really like the way it was set up, and so we would like to see all the AAAs use it. So thank you again, Emily, and thank you in advance, all the AAAs, for helping us look over this proposal. Thank you. That's it.
Thank you, Lisa. Recognition and Awards Committee.
So we're on a break for a little bit, and then we'll start up again.
Okay, I'm sorry, Rick, what's your next meeting?
I don't know, November probably.
November, October, November, I think.
Yeah.
Okay. Going on to unfinished business, review proposals on homelessness and determine Pabia's role in this proposal, consideration for an ad hoc committee. I'm going to defer that till after we have, public testimony, because I believe Sarah has something at that time, correct? Okay, so when we do the public testimony, but we will still continue leaving it on as unfinished business, okay? Going on, new business. Review a proposal to change the Hawaii Revised Statutes 349-4 regarding the Policy Advisory Board for Elder Affairs, number of meetings in the calendar year. Okay, please take one and pass the rest down. Please.
Let me bring it up on the.
Okay, yeah, can you bring it up on the screen for everybody else? You can have to share.
Yeah, I will, hold on, I gotta find it.
Okay, as the director and I were looking through all of these things to see how we can make the best use of our time. We looked at the calendar, and she finds it on her, bring it on the screen, bring it on the screen. And we found a section here that talks about how many meetings that we shall have. And here she goes, you know. Okay, so you need to make it a little bigger, yeah.
We minimize. And let me, okay. So I think the part is a big
Can you make
paragraph.
it a little bit bigger for the people who are online?
I have to do it over there. I can't.
Okay.
Actually, it's good. Online, it shows really well. Yeah, it's good.
Okay, thank you, okay, thank you.
So read your paper. Don't look up there.
So for those of you here, you have a copy of it, and the part that we are looking at is just where it's about the fourth or fifth line from the bottom before letter B, and it's highlighted. So Caroline, you wanna go on?
So as I was preparing last month for our orientation, and as I was watching, and looking at what our committees do and how fast these meetings come every 4 weeks when we meet every first Friday of the month, right? Sometimes it comes like this past time, we met 3 weeks ago, right? Because we met on the 11th because of the holiday. That's not why we're doing this. What the impetus for this really is for the committees to do a lot of the work that we have the committees doing so that they can have time between meetings to really do that internal work and bring it back to the board. Now, this is just saying that this would be like the minimum. So we were thinking that the committee meetings could be between the board meetings. So we were recommending, and this is just for review, 7 meetings of the board each year, and then monthly meetings during the legislative session. So that was one, and then Bev said, well, what about that other one we were talking about too? So this was just a written one that we wanted to share, but we just wanted to put it out there for all of you to think about, to open it up for discussion. But what I'll do is I will hand it back over to Bev, but I just really wanted you to understand that it's so that we can make the best use of our time when we come back together as a board. And have time for some real good decision-making or policy development that's gonna brew up from, like, say, PPRC or the Ledge Committee and things like that. So that's what the idea was around this proposal.
And I know some of you are gonna think, well, how is my committee supposed to meet if we're going to cut down the amount of POBIA meeting, okay? And so this part is up for all of it is up for discussion. But we thought that maybe the other months that we weren't having a POBIA meeting, it would be time dedicated to your committees, because as you all see, sometimes an hour is not enough to discuss everything that you want. So, it could be that legislative time, definitely we have to meet monthly, but as the legislative committee is preparing for the session, they need a little bit more time than just an hour, hour and a half to do these things. So that was just another thought, that the months that we don't have a POBIA, we could still have those committee meetings and let it run longer. Okay, so it is up for discussion for everybody.
Is there any violation of the boards and commissions policies at the governor's
Okay.
office or the number of meetings? Are we violating that?
So Caroline is going to check on that part, just to be sure that we are.
Right.
And, the other part is that I think we'll check with the AG that's assigned to us to make sure. Yeah, we'll check with the AG who's assigned to us to see. if
Because
we
this
are
is
gonna
cutting
take
our
compliance.
meetings in half, almost cutting our meetings in half.
Okay, but it's a question that we'll ask. Okay,
So,
that's the
So-
proposal.
okay, so you're suggesting that we still meet every month, we still come here every month, but that PABIA would only be
7 months.
7 of those.
Right, the other
So-
5 months would be committee times. And like Rick chairs 2 committees, that maybe he may want to use one of those for, on a particular meeting day, he may decide, you know what? I want to use half for legislative, half for recognitions and awards. And I think that part becomes a little bit more flexible. I mean, taking everything into consideration. Because there's some work that really, it's hard to do just online, and it's better when we are all here in person to give their opinions and to offer this help to each other. But like we say, it's just a suggestion, taking what Marilyn said into consideration. We will check with the Attorney General to see if we even can do it. And I mean, if we cannot, then it's a moot issue. But before then, it's better to have this discussion. And everybody can give their input. And I know it's a new thing and it's kind of hard to digest all in today. So I would suggest do your homework and we will bring it up next month as a
Yeah, so the committee meetings then, if we went this direction, would they stay hybrid or would they be? So right now, RAC, we just do it Zoom, but the legislative, we've always been hybrid. So that opens the door up for whether we
It would
change that
still
or
be,
not.
it would still be hybrid. Sunshine says you must have a hybrid.
Have you
Sorry.
Oh, it
considered,
does?
Mm-hmm.
Doing both? I mean, why can't we meet committees 9:30 to 11:30, 2 hours, and then go right into the.
Because then sorry, human needs come
Lunch.
and lunch. I'm sorry. I mean, I gotta speak up on behalf of not only myself, but for all the committee members. We don't know their health conditions. Some people may be diabetic that we don't know. I mean, some people have conditions that we all don't know about.
How about
It
9:30
necessitates-
to 11:30, then 11:30 to 12 for lunch, and then
No,
the
'cause you gotta
meeting
go get
starts at
lunch.
12.
Sorry,
May
I
not be
mean,
back in time
you
to
know,
have that.
we thought of all the scenarios when we did do this, okay? We cannot start earlier than 9 o'clock. Okay, because yes, it's possible for the neighbor islands to come in, but you're asking a bigger burden on them. 9:30 is a good hour, and I feel between an hour and a half at the longest for a committee meeting, because you still need to get lunch, and you need to have time to eat the lunch. Okay, and Fobia is set at 12. Carolyn?
And then I'll add to that is, we used to eat lunch right during the meetings, and
Yeah.
we could make it a working meeting like that. I will tell you, it's very disruptive. For the people on Zoom, because all they hear is. They see us eating, and if you're right up, yeah, so I
And
mean,
they
we
may
want
be
it to be a. Yeah.
And the other part about that, I mean, you know, just computer etiquette is, if you're having a meeting, if you're eating, get off the screen. I mean, you shouldn't be visible eating in front of everybody else, you know, I mean, it's just courtesy to the others that are there. But it's something that, you know, hybrid is always going to be here with us. We cannot change that part about hybrid. But it's a proposal that we have and we'd like you to think about. And like I said, it's something new that we just brought up to you that, you know, you don't have all the pros and cons in front of you, but within the next few days, you might say, hey, you know what? I like this, I didn't like that. And if you could just note it down and bring it back to us at our next meeting, or if you have it, send it to me and I can forward it on to Caroline. But if you have ideas and things like that,
Well, let me back you up. So RAC has always been just Zoom.
Mhm.
You said that it has to be hybrid.
no,
Okay,
oh, well,
yeah,
yeah.
so it doesn't have to be, right? 'Cause it could be Zoom.
well, let's put it this way. I'll let Caroline
Okay.
get that one.
I think, it doesn't have to be hybrid, or I think it's,
For clarification.
yeah, I think, I'm pretty sure, I'm about 99% sure. It could be all Zoom, it could be all in person, or it can be hybrid,
Okay,
yeah.
And we will clarify that too.
yeah. just
Yeah.
hope we
Yeah,
have that
yeah,
flexibility.
we'll have that
Yeah.
clarification. Okay, thank
Okay,
you.
thanks.
Thank, good question. Okay,
Carolyn,
yes, Bill?
what was the average attendance before hybrid was incorporated?
Actually, since I've been director, I've had quorum for every meeting. So
In
it's not a quorum, well, it's not, we're not talking about that, because hybrid is how we're going, it's how people have complete access to our meetings, so that's not changing. I've always had quorum, I know there was quorum issues with the previous director, but we've always had quorum, so I'm happy for that, and I'm very grateful, so I thank all of you, even all of you on Zoom, that we have quorum. It's not a quorum issue, I think it's more, and I will say, this came from me, I shared it with Bev, how we could make the best use of our time and really bring those issues from the committees to the forefront for discussion and deliberation. We just thought if we had that space and latitude between the meetings, and that's where this came from. So it had nothing to do with like quorum or attendance or anything like that. But that's a good question, Bill.
Bev,
Yes,
so it, I guess it looks like we're talking about having PBO meetings, full PBO meetings every other month, except for that stretch while the legislature is in session. That's how we came up with the 7. Is that,
Yeah.
would
Yes.
that be accurate? Okay,
Yes,
all right,
and then the other 5 months would be for committee.
committee meetings.
And that is my proposal, because how else can a committee meet, you know, in order to really come up with a nice package? And you know, the way we've been doing it is, and I'll say this from Ledge Committee, is that within that given time, you can address maybe 2, 3 at the most, really well to digest the bill and everything else, and to get good clarification of what's the pros and what's the cons. And before you know it, you don't even have time to wrap that up, and time is there. So this way, it gives committees that flexibility and that time to do those things.
The other issue was too, we used to have legislative committee meetings twice a month.
Yeah. I
For
remember
years,
those, yeah.
for years, we had them in the interim, so we had it at the regular Pabia time, and then there was a special one. And that was especially during the session, so you can have as many of those as you want, that's
Correct.
another alternative.
Committee meetings can be as many as you want to.
So because there's a lot of business goes on legislative, during the legislature and just before, so that's another alternative, if you wanna look at that.
I'm sorry, so in the months in which we do have a PBA meeting, would there also be a committee meeting or no?
Yes,
Yeah.
There would.
There would
yeah,
be.
Okay.
And when you think about it from the point of sunshine law too, like today's meetings, like. I'm sorry, I had to leave during your report, but were you reporting on what you guys discussed today? Yeah, honestly,
Yeah.
we can't, because it's not on the agenda that went out 7 days before. So what you should have reported on was, like, say you had had a meeting last month, it would have been last month's meeting that you would have been reporting on today. And then this month's meeting would be reported at the next, see where it gets kind of funky?
Yes.
Sorry, that's a wrong word to use, but so we thought
I like one.
wonky, that's a good word, I like that, wonky. So we thought that way we could ensure that whatever's being discussed would be able to get on the agenda for the next PBA meeting, and that's kind of where the conversation, yeah, the thought for this proposal came from. Yeah,
Cause we've always done the meeting that we just did.
so she doesn't, well, like when she was chair, she never did, she'd just say, we met today, and then she'd report on the meeting from the month before, yeah.
Yeah.
Yeah,
Okay.
yeah.
so if the committee doesn't mind, can we put this under? Well, it's under new business now, but carry it over to unfinished business for next month, okay?
Okay.
And we'll bring it up for further discussion, because I think it's something that everybody needs to be aware of. And I do suggest, come up with things, if you think it's a workable thing. What Marilyn mentioned about Ledge having 2 meetings a month, that's fine, you know, but it's something that there are alternatives out there too. Okay, but thank you. Moving on, public testimony.
Beth,
Oh, I'm sorry, Barbara?
I just like to say that, just writing this down, if we met, say in January, which I think is a good idea because it's just before the start of the ledge, and then February, March and April, because those are the main months of the ledge. That means for the next 8 months, we're only gonna have 3 meetings.
That's only 3 PBA meetings,
Right.
but you would still be having ongoing,
Well, but it
Oh,
says, it
but
says
no, I know
not
what you're
less than
saying.
7.
Yeah.
It could be more.
right, it just says no less than,
No less than, yeah.
should not be less than 7, but you could always have more. You know, so, because it says even now, there shall be not less than 12. So,
I don't know, it just seems to me that 8-month period is pretty dry. In terms of PBA meeting, full meetings.
actually, that's 4. There's only 4 months. Cause if there's 12 months in a
There's 8,
year, 7,
yeah.
5 months,
Well, like I said, if you met in January. am I
that's
getting this
4,
right?
then you give us 3.
Yeah, that'd be the first 4 months of the year we'd meet, and then for the next 8 months, we'd only meet 3 times.
Well,
Go for it.
there are some questions that we have that we need to be clarified first, but, you know, we'll take that into consideration also. And bring it up next month, after we get the questions answered on our side too.
This state, so you have the lunch out.
Okay,
What is the efficient?
thank you.
45.
There's no public testimony, and we have Pabir reports from appointed members, Rainey.
Oh, there was, Fencer, Hawaii, he's a service provider, so they just recently added in a new thing, which is, ride appointments. So, so they can do door to door. They vet all their people, make sure they have insurance and all that kind of stuff, so it's just, he's done presentations here before, but, he just emailed and saying that they added on to their repertoire.
This is like an Uber.
Venture Health is, they, if you go into their app, you can request like, you need a housekeeper for light housekeeping or other services, that's what they do.
Statewide.
I'll have to double check, but I know he's very here on Oahu, but I'll double check because I can't confidently answer if it's.
This is for fee.
Yeah.
Okay.
For
that's not it.
Yeah. And so like for me, I can order one for my auntie, pay for it
I see.
and that kind of stuff.
Okay.
Can you tell me what that is, Ray? You know, can you give us an example of what it might
What the
cost
fee
for a
might be?
doctor appointment? Fee. I'll find out from them. Okay. Thank you.
And so for those of you online, the website is on in the chat, okay? I think, yeah, the
I
chat,
did,
I saw the chat
There
there,
it is.
okay?
This is just Oahu.
Okay, and right now it is on Oahu probably, but we will, like Rainey said, we thank her for bringing this to our attention. But you can go and check out their website and for more information about that. But you know, she's just bringing us for information for us, that it is a service that is available for seniors
Just Oahu.
for paid.
I believe it is just.
For right now, I would say it's just Oahu, okay? But going on, Sarah presented to us a few months ago about shelters. And she's done some follow-up and she'd like to give the board a follow-up comment. Sarah?
I do.
Bringing it up,
Wait,
Sarah.
Sarah, hang on.
Okay. So, Caroline was nice enough to put together some slides to help me. And I appreciate that because I'm computer challenged. I mean, this is my computer. And computer, I can hook it up sort of kinda. So it's kind of difficult for me. But I guess basically my concern with the people who are unsheltered is that there are a lot of services available to them, but there's a lot of pukas having to do with the fact that they are unsheltered or barely sheltered. And I think that's something that we need to think about, alternative ways to help them. And I'm going to give some examples, but I also want to talk about to sensitize everybody to what some of the issues are with our homeless, specifically our female homeless. So, Caroline found this slide, or did you make this slide?
Oh, no, I just kind of pasted it
Yeah.
out, the point,
Okay.
partners
so-
in care.
Right,
kind of
so there was a count. In 2024, they haven't done one and they're not going to do one in 2025 nor 2026 of homeless. And that this count is based upon, people just going out and 1, 2, 3, 4, 5, and not necessarily actually talking with people. And it's a voluntary kind of thing, and homeless. And so they they have these numbers here that may or may not reflect the number of people who are at risk for shelter instability, or however you want to say that. I focused on the ones from Kona in particular because of, yeah, please change the, it's kind of hard to see this distribution. But one of the things that we hear all the time is, these people aren't from here. And if you can see that, it's kind of hard to see that. Is there a way to zoom in on
I
that?
am gonna see.
Okay.
Getting close
But you'll see the
to-
blue
Yeah.
part, this is just in Kona. And the blue part has to do with, it has to do with the ethnicity, the slide. And you'll see that 40% of the women that are recognized as homeless or, not,
Yeah.
they don't have stable housing, are Native Hawaiian and Pacific Island. And it turns out that Hilo is much the same. And these are elderly women above the age of 60. So if 40% or 42% of them in Kona are without stable housing, that has great indication, and it's a good indication of how they're getting around, how they're doing. And there are a lot of services available. But when I've been helping a couple of them, it's been very eye-opening. For example, one person that I've been helping doesn't qualify for Meals on Wheels because she can walk up to the bus, the Helion that comes every once in a while, and get on the bus and get down to Kona to one of the shelters offered by Hope Services called the Friendly Place.
This
And
is
she can
Norma.
get us there.
Hi,
Oh, wait, Norma? Hold on.
I'm on a Zoom meeting, but I'm gonna.
Yes, okay, there.
Okay,
Sorry about that.
Sorry, so she can get there, so she doesn't qualify for Meals on Wheels. And because she doesn't qualify for Meals on Wheels, she has no way to cook. She actually does live in a house, well, she lives in a tent on her property. And there are a lot of squatters on her property also that have just arrived and shown up. She doesn't have electricity. So she has no way to cook anything. She can go down to, she goes down twice a month to get, to the food bank to get food, but it's mostly canned goods. She's 84 years old and quite elderly, and she's got a lot of other issues. So it's very hard for her to open up a can. She can't heat it up because she has no way to heat up the food. She has SNAP, but at SNAP, it turns out you can't buy anything that's prepared. So you can't buy hot food. You can't buy a cup of coffee. You can't buy a fruit bowl. You can't buy poke because it has rice or a poke bowl. So you can't have anything hot or prepared. You can't buy a plate lunch. You can't buy it what is offered at the grocery store. The idea, I guess, is thinking is that you buy it something from, the outside of the grocery store and you take it home and you prepare it. But if you have no way to prepare it and you're not strong enough. So, because she has all of these issues, she has taken advantage. She's doing the best she can, but it's not enough. So how about the next slide? So there are some myths that I found from working with a couple of these ladies. Now, I'm a retired school teacher and I don't have training in social work and everything. So I'm kind of going through, it's been really eye-opening. I've heard people say, if you help them directly, you're enabling them. If I give you a card to KTA, the grocery store, I'm enabling them. They could be getting a job. Well, these elderly women who are living on $700 to $800 a month. And that's supposed to pay for everything. And that's their Social Security. And some of it's not even their Social Security. It was their husband's Social Security because they are living that way. Anyway, I've heard comments about their freeloaders. Looking for a handout. That they're from somewhere else. I mean, that one slide that showed that 40% of them are not from somewhere else, and again, that's probably undercounting. Lots of them may be drug addicts and unstable, that may be true. And having seen for myself how people are reacting to them as they come, as they're walking around and whatever, it's not surprising that some of them might find solace in some way by being stoned in one way or another. There are a lot of organizations. There are a lot of organizations. It's amazing how many there are, but there are definite pukas. For example, I took, my friend, who you're gonna see in a few minutes, to get some assistance. So we went down to the police department. She needed help because these people are on her property, of which she's greatly in arrears on her taxes, so she will probably lose the place. They have trashed the place, and so she's trying to get them up. We went down to the police station, and the first thing that the police said to her is, "Oh, you and I have history." And this is the person who's the community police person. "You and I have history." And I was there and I said, "Excuse me, this lady is 84 years old and she's here for your help." "Well, I tried to help her 4 or 5 years ago." "Well, this is now. And she needs your help." "Well, what does she want?" Say, "And we're in the room right together." So his attitude was really quite negative. And she was ready to bolt at that point. And I said, "We are here because she needs some legal help." "Well, I can't help her. She needs to go to legal aid." "Well, okay, do you have a way for us to get?" "Oh yeah, you gotta go down to the county office and you gotta go to the window." So I took her down to the county office. We went to the county office and they gave us a bunch of forms and I said, "How do you fill this out? They're not renters." "Well, go to the self-help people. They come once every other Wednesday and, they'll help you." So we went that following Wednesday, happened to be the Wednesday, and we stood and we waited. We had to stand there and wait for, at least an hour and a half. And we got to see an attorney who was pro bono, and he said, I can't help you. I can only give you information. Here, and I said, "Well, all right, the information is," now meanwhile, this is a lady, and I've had several others who don't have a phone. You have to go online to get the form. You have to print it out. "Can you print it out for us?" No, I'm here to give you information. We went to the Office on Aging, asking if we could meet with legal aid there. "We are unable to." No, we're here for information. We're not here to, you need to talk to adult services. So I've been calling them Adult Protective Services every single day. I've yet to talk to somebody. I didn't realize that when you make a phone call to Adult Protective Services, after you're done talking, you have to push the pound button. And then you have to approve your message to push number 2 for it to be sent.
Oh my God.
So those are the kinds of things. It doesn't say on the message that you need to push pound to leave the message. It doesn't say that. So for the people who are trying to help themselves, or people who are trying to help them who are not professionals, there's a lot of things that need to be done. So let's look at the next one. Slide. It says, "Treat me gently, I'm hurting." I think that in terms of the women that I've talked to, and I know I had mentioned that there was a group of women that live not too far from the, where the cats are fed. At the old airport. And that a number of them, go there because they find company. They find company and somebody to talk to who's, you know. And of course, the cats are kind of their Kuleana too. They're part of their family. I know it sounds goofy, but they're hurt. They're really hurt. And they put off, they've talked to me about some of the things about how they put it off, it builds up, they don't know what to do. And they don't have the same kind of advocate. They can go to the friendly place, which has been great. They can shower once a week. They can collect their mail there. Somebody had suggested they go to the post office and get on general delivery. You have to have an ID. And the Kapuna card doesn't work as an ID, I have to tell you sadly, it doesn't work as an ID. So they can't use the post office as their mail. They have to, so the place like the Hope Services, they offer that opportunity. Most of them are not computer savvy, they don't have phones. That means that the Legal Aid Society can't call them to set up, it's only by phone. It's not, you can't actually have an office to go talk to somebody, you have to do it by the phone. They don't have phones. I mean, there's just so many things, right? The question is, I need so much, what can I do? And then I judge myself harder than I should. And like I said, so many of them are above 60. They're on Medicare, Medicaid, if they can get it. They're not sure what to do, how to sign up. I told them about, you know, this office now, they could sign up and get information about it. It's too much already. And they don't have a way to, they don't have a social worker. They don't have I had talked to, I've gone with this other lady to her, doctor's appointment to try to get the doctor, she had fallen and had the bell busted up on her. If she could get help on the, as a, what do they call that? A caseworker who can help her, you know, to make sure she got to PT and so on, because she has to take the bus. This is another bus lady, or walk to the place to get it, because we don't, maybe these people can help. Anyway, because they were able to get to the PT, they were dismissed from no caseworker. So the question is, I have for you is, you know, what can we do? So it turns out, I read in the paper, yes, just today, that the Hawaii County's Office on Community Development has just some low interest loans to help low and moderate income houses, families repair and improve and modernize their primary residence. So for 2,500 to 50,000, they can get a simple interest rate to homeowners, and maybe that will encourage people to do some multi-generational housing.
Oahu County has the same thing too.
Yeah. Well, this apparently is new, and that Senate Bill 1218 has to do with finding ways to promote affordable housing. And I'm not sure each county is going to do something different. So basically, the question is, how can PABIA help? And really, there's a lot more questions than answers, unfortunately.
One thing with, maybe PABIA can get behind, 'cause with SNAP, you have to use it to prepare your meals. But what I'm finding out, being single, it's actually cheaper for me to buy my food versus going to the grocery store and buying food to cook. I'm actually finding it better for me to just go out and buy food, you know,
One meal at
or
a
plate
time.
lunch, and
One meal at
then
a
sometimes the plate lunch is big enough, I can split it
Yeah,
in two.
right,
Right?
right.
But I actually have been, the last couple of months, I've been noticing, it was cheaper if I go eat out than
Right,
to buy food.
right.
And I noticed in 7-Eleven, when you go to, I mean, they've got a big array of stuff to pick.
Reasonably priced.
But to qualify under SNAP, you have to heat the food for it to qualify.
Right.
So they will have it in the cold section, but once you put it in the microwave to heat it up, now it qualifies for SNAP. So I think maybe we
No,
should
it does
try to,
qualify for SNAP.
or one of the two.
It does not qualify.
If it's hot,
Yes, if it's hot, it does not qualify. You have to take it out of there.
That's why you can buy it cold.
You have to
and then
buy
you
it
buy it cold and then you put it after. You buy it cold, so maybe we should have it where SNAP is, it doesn't matter whether it's cold or hot. You know?
It would be better if it doesn't matter.
Yeah, that's what I
Okay?
said.
Because you can't buy it for people.
Can we,
Yes,
can we come back to what we are here for?
yes,
I heard Sarah's question is, what can Pavia do?
right,
And at this point, we can toss up all kinds of ideas.
right.
So I would suggest all of you go home, come up with what you think is a feasible thing that Pavia can do, and bring it back to us next month.
Okay, well, I have some
Okay.
ideas.
So,
Can I
Yeah,
make a
okay.
suggestion?
Yes,
If you could email us some your suggestions, so
Yes.
we can think about
right,
it.
Yes.
because that's a good idea,
Okay.
because Sarah, that way, they won't duplicate what you already have, and they
Okay.
can just add more
Okay.
to. So I think that's a very
Okay.
good idea, that's a good starting point. Yeah. So,
Okay. One more slide.
okay,
I have one more slide.
Yeah.
Too. I want you to look at this lady. We were celebrating the fact that I took her to get a funny coffee. She doesn't drink coffee, but this was one of those ube latte, something or another. And you can't really tell her from her eyes. This woman is hurting. This is my 84-year-old lady who walks the streets because trying to get herself to PT, trying to get herself to a medical appointment, trying to take a shower, trying to get a meal. And we were celebrating the fact that we actually got a form that she could somehow get these people off. She has to find somebody to present it to those people who are sitting on her property. But, I have other pictures of the place that's trashed and, you know, and she has some definite health issues. 84. She probably has some dementia going on. She's definitely, you know, where her family is.
Who knows?
Who knows where her family is?
And you know-
Yeah, can I
Okay,
just add
good.
real quick and then I'll pull that one. But I think to summarize is we all probably have this throughout all of our communities, right? So
Yes,
this is a profile of what homeless looks like in our communities.
Yes.
So, and I think a lot of it, and hearing what you're saying, all those barriers you had this is an access issue too, right? So how
Right.
do you address an access issue? And I'll leave it at that.
Or
Right,
it's
you
a
know-
definition issue too, right? Because she's technically not homeless.
but she has a property, that's why.
she has a well, it's in greatly arrears and she will lose it. Because she is, yeah,
So, you know, but like Caroline says, that is true,
My question is, how do we get them into our system and make it work? It's not.
sorry, I was just reading Jeff's notes over here. But, I think it is something that we have in every single community, and if we can come up with what things that Pavia can do, that would be a wonderful thing. So please, Sarah will make sure that the list that she has is provided to Josephine, who can send it to all of us,
Mhm.
and we can come up with more
Mhm.
suggestions,
Mhm.
okay? Thank you,
Yes.
Sarah, that was a very
Yes.
thorough thing for us. And,
Okay.
you know, it's an eye opener because of the loops that a person has to go through. And I realize that some places are only for information, but yet to be told, from this place, now you need to go to this place, now you gotta go to that place. And sometimes, you know, that's why we say sometimes it's better when you have all in one shop,
all in one
all
shot.
in one shop. Shelley?
No, I was gonna ask if you can just quickly go over some of the suggestions that you have
Yeah,
for,
right. Well, I think that we can advocate for the current services that are available. A lot of people don't know what's going on. They just see a pile of people, you know, coming out of Hope Services or that church or that area where they see people, you know, there's a tent and things are handed out. to try to build support for people in the environment. To let people know that there's, there may be help for you to renovate your carport so that your mom has a place to go. Right now, your house is not appropriate for her to be in. Because it's, she can't get up the stairs.
Can
You know,
make a suggestion?
yeah.
Sorry. Yes.
Yes, there are goods in the services. yes.
They're so subject to
There-
abuse and
there's so many.
neglect.
Right.
But
That's
I
the big
think
issue.
a way that Pavia could really get behind this is on the legislative side as well.
Oh, yeah.
Because
Yes,
there are so many services, but there's not enough capacity. There's not enough
yes.
funding to service all of the needs of the homeless, of our unsheltered. So across the state, yes. And across the nation, right? But there's not enough funding for a lot of the projects that would like to be pushed out to help to get these people the help that they need. Because sometimes when you approach them, they don't want your help because they're not in the capacity, to receive the help yet. They're not ready themselves, right? So yes, we have lots of pukas, but I think on a Pabia standpoint, if you can really push on the legislative side to get funding to the counties so that we are able to service these people because we don't have enough funding. There are projects that
Right.
need to be done.
But again, it's not just serving, right? It's help, it's making that happen. And one thing we can do is to support the idea of multi-generational households. Yeah.
Thank you.
So I look
very
forward
much.
to your email.
So, it'll come from Josephine. The
Yeah.
email will come from Josephine. Thank you, Sarah, though. Okay, going on to our ex officio members, I saw Kathy Ishihara there. Kathy? Yeah, she's beautiful. Oh, there she is. Kathy?
Hi, good afternoon. I'm Kathy from the MedQuest Division, Medicaid, Department of Human Services. I had put in some information on last month, but I think it didn't get out. And I did have some IT issues, so I apologize that I wasn't able to get on last month's meeting. But I did want to report that, as we all know, President Trump signed a big, beautiful bill on July 4th. And in that bill are Medicaid provisions such as work requirements for Medicaid and some other financial stipulations. We know collaboratively, the state, the department, the legislature, the governor have all ensured healthcare access to all here in Hawaii. And what I'm going to do is I'm going to schedule and request Meredith update Pabea on some of these Medicaid provisions. She's involved in the departmental interactions and plannings of these provisions and also can do a Q&A. I'm sure probably the department is going to come out with a memo, a guidance memo in the next couple of months. So I'll try to schedule that. And for people who don't know Meredith, she is Hawaii Medicaid Assistant Administrative Deputy. She had come on Pabea previously, and she has a wealth of information. I do believe that the Medicaid bill enactments are due late next year. So I'll try to get Meredith in and schedule her with Caroline, and hopefully she can update us on some of the planning provisions regarding this bill.
Thanks, Kathy. I think Christy was there. But let me see. Yeah, Christy's there.
Hi everyone, Christy,
Hi,
UH
Christy.
Center on Aging. I did not submit anything in advance and don't have anything to report right now. Thank you.
Thank you, Paula.
Hi, everyone. No reports from the Department of Health either.
Thank you. Anybody from DOT? No, I don't think so. Okay, Alan?
Thank you. The very little to report in terms of Senior Farmers Market or any of the other things that I have mentioned to you in the last report, oral report. we're getting a small amount of additional money in Senior Farmers Market, and we'll be able, with a new contract, to reach back and expend holdover carryover money from our ARPA sub-grant from last year. Basically, what we're doing is we're going to fill up a couple of the wait lists that we have, not all the way. There'll still be plenty of people who will have not gotten served this year for Senior Farmers Market. We just don't have the funds, and we're going to have to just hope for the best next year, year after. But basically, there's very little funding there. We are working on, there was some farm to food bank legislation that the state legislature passed earlier this year. And we're still waiting on a couple of things before we'll be able to get that out in requests for proposals and get the food banks to put together something, but we're not ready to do that yet. So not very much to report. A little bit of extra food money is now kicking around, but that's basically it. Hawaii does remain in a state of food sustainability problems. No doubt about it.
Thank you, Alan. Okay, I don't see DOE there. Okay, Derek, it's nice to see you here this afternoon. Yeah.
Well, thank you so much, everyone. For those whom I have not met, I'm Derek Lam, the Regional Administrator and Staff Director for CMS San Francisco. And in my capacity, I lead and coordinate local external engagement efforts with all regional stakeholders and customers in beautiful state of Hawaii, as well as Arizona, California, Nevada, and the Pacific territories. I also provide administrative and operational support to all employees in CMS San Francisco, promoting cohesion and collaboration throughout the region office and with other CMS components. Since you mentioned about the Medicare open enrollment, I want you to know that I have served as the co-lead of the CMS Medicare open enrollment since October last year. And this year I'll be doing this along with the regional administrator of Boston. And so more news to come. I would like to take this opportunity to do a few things, but first and foremost, I want to send greetings from CMS Administrator, Dr. Mehmet Oz, who started his tenure with CMS just a couple of months ago. And he did come and visited San Francisco the first week of May. And so he wanted me to let you know that this year marks the 60 years since the creation of Medicare and Medicaid, two programs that have shaped the modern foundation of American healthcare. And today they provide coverage for more than 160 million people and continue to be vital lifelines for older adults, people with disabilities, and low-income families in over the US as well as the outer Pacific. So the impact goes beyond access. So say, for example, Medicare played a key role in the desegregation of American hospitals. Within months of the law being signed, 90% of hospitals accepted Black patients, changing our healthcare landscape forever. And the landscape of Medicaid, it helped launch coordinated care models that continue to improve patient outcomes today. And as technology has evolved, these programs have evolved as well, supporting everything from telehealth to remote monitoring to better reach the people they serve. So during the last few months, CMS has cracked down on the largest healthcare fraud schemes in US history, launched reforms to overhaul prior authorization, and invested in modern tools like real-time data to better protect patients and preserve trust in these programs. And at CMS, we are honoring this legacy by taking decisive action to reform, strengthen, and safeguard these programs for the next generation. And we're driving innovation, improving outcomes, and protecting the integrity of Medicare and Medicaid so they remain strong for decades to come. So we invite our partners, like the ones that we are meeting with today in Hawaii, to mark this milestone not just with celebration, but also with action, to work with us to drive innovation, eliminate waste, and ensure these programs continue to work better for everyone. Now, as you may be aware, Sharon Yee, our beloved staff at CMS San Francisco, has since retired from CMS after 42 plus years of excellent federal service. So before she left, she reminded me if and when we are allowed to come back and meet with all of you at PABIA, she wants us to send her greetings. Now, I want to introduce our new liaison to PABIA, and that is Janelle Herndon, who is the state lead for the state of Hawaii, as well as the Outer Pacific. So I'd like to ask Janelle to take a few minutes to introduce herself and to make some remarks. So Janelle, over to you.
Thank you.
Hi, everybody. My name is Janelle Herndon, and I'm going to keep this short because I know you guys have a time crunch. I am the provider liaison and also the outreach specialist assigned specifically to state of Hawaii and also the Outer Pacific Territories. For the past few months, we have been on a communications hold, and we're very excited to start working with our partners again. So very nice to meet you all, and thank you for having us.
Thank you. It's nice having you on board. Thank you, Derek, for all that information. Okay, going on to agency reports. We thank all the agencies for submitting their report. But with what happened just this past week, I would like to ask if you folks could just give us some information of what are some of the reactions that you folks had on maybe Tuesday, maybe Wednesday from your clientele because of the alert that we all received island-wide. Okay, give you a moment to think about it. I don't know, does Derek have a representative here?
Thomas is here.
Okay, Thomas is here.
Hi,
Thomas,
aloha.
Hi, since you come from the business area and you had lots of traffic on the road.
Yes,
you
we
folks receive did you folks receive any calls from any of your clientele?
No, not specifically to our office. What happened was when the emergency was enacted, we did identify the senior centers that were in potential harm. And so we were coordinating with our emergency department. And so thankfully, everything played out well. Traffic, after the fact, we got quite a bit of calls with regards to being just gridlocked, and anxiety levels were going through the roof and things of that nature. So again, thankfully nothing happened, nothing transpired, but going through that exercise was quite hectic, including for staff too. Yeah.
Thank you. Okay. Kauai County.
Thank you for this opportunity to share. So similar, it's not so much that our office got the calls, but I was very satisfied with the way our ARC and our agency handled the calls because it came so late in the day and we didn't have much time. As you folks knew, we got a directive from our managing director to send everybody from the county home. But we had our staff that stayed and made sure that every single consumer was contacted that lived alone, considered high risk. They wanted to make sure that even though the alarms were going off, that they had a place to go and they knew of the situation. We did have a couple calls where it wasn't specifically our consumer, but someone that we all is pretty near and dear to us our agency and is involved a lot, she had an issue with her son, couldn't get him in the wheelchair, and so we worked all together. We were able to make the connection to call the representative that was at Kima and help her. And so we had it, you know, like everyone, it was good practice in a sense where luckily nothing serious came of it, but it really made us look at our emergency disaster plan. And then in the future, think about the different scenarios. And so that is something that we are going to be working on in the very near future to tighten that and to streamline it, because we can always improve, right?
Thank you. Okay, Erin? Boy, I'm,
So and then, it was a really nice time to see how our action plan works, right? So Hoya Island works with their partners. So the partner, we have a list, right, of all of our kupuna, but we actually use our partners to make the calls. So we stood as the backup. So we were at ADRC until the very end, but we actually had to leave as the backup. So all of our partners did their jobs. We really didn't get any phone calls to on top of just our normal phone calls that we inter-county phone calls. But our role was to get whatever information from the EOC over to the partner. So as soon as we knew what shelters were going to be available, that went over to our transportation partners so that they were able to assist kupuna to get them to the closest shelters. So it was actually really nice to see that our plan did work. It kind of ran smoothly, you know, of course, the traffic issue, right? I think everywhere there was a traffic issue. Those that kind of waited out a little bit, we saw that there wasn't as much traffic as you got a little bit closer, but just a little bit of anxiety of everything. Yeah, everybody wanted to get out. But as a whole, Hawaii County's plans work. So actually next week, we're gonna be meeting with our partners to do a debrief now that we have our new exec coming in. So today is her first day. So we'll be lots for her to like listen to, look at, probably next week is what we're aiming for. But as a whole, Hawaii County's emergency plan for our kupuna worked. It worked. You know,
that's good to hear.
yeah, so we really were the support for our partners.
Thank you. Very good. Thank you. Rowena?
So what was interesting was on the day of the tsunami alerts, in West Maui, there was a large bingo blast activity for the seniors sponsored by Kaunoa, and it took place before the alerts went out. So, but at that time, you know, I think what really helped was the notifications. The seniors had mentioned they got a lot of notifications on their phone. They were tuned into the TV and the radio for updated information. So that was good. But some of the challenges that we experienced was, number one, our data system on WellSky we couldn't pull up or create a report on the seniors, or we couldn't pull up our emergency preparedness database to identify those seniors who lived alone. So that was a big issue for us. The second was the gridlock on the roads. And, you know, we've kind of known about this issue for a while now that, you know, imagine having thousands of people try to access the roads all at the same time. You are going to create a lot of gridlock. The other issue was that some of the seniors, although they were able to evacuate to the shelters, some of them didn't feel prepared, and that, you know, if you're given maybe 5 minutes, even that is a luxury. If you're just given minutes to put your things together and grab whatever is necessary, they felt like they weren't prepared for that. And that's an emergency preparedness, you know, an issue that we always raise when we meet with seniors and conduct outreach, is to have a go bag ready. But even for our family, I mean, the first thing that came to mind when I drove home that day was we just ran out of water. You know, I need to go and get water. And I was there along with 20 other people at the water store, filling up the big containers. So, you know, those things. Number one, the reliance on technology to pull up information. If the system goes down, we need a backup plan. The second is knowing where your evacuation routes are and making sure that we're working on you know, emergency planning or working with transportation officials to identify best routes. And then third, stressing the importance of having a go bag and being prepared for these emergencies.
Thank you. Thank you. And we thank all the directors because, you know, it was a trying time for everybody. And I can just imagine those seniors that you folks have clientele with. I mean, the anxiety level they felt that day. Okay.
Bev,
Yes,
I
Steve?
just have a question. I'm just curious.
Mhm.
Do the ARCs have the ability to survey their clients to find out how many of them you know, were unable to evacuate who wanted to evacuate, or to get some, you know, sense of the
I
scope
don't
of
know.
the issue or
Any
the,
director wanna answer that?
yeah, I'm just
Yeah.
curious, yeah.
Mhm. Yeah, I wouldn't know. Rowena, Emily, Aaron?
You know, this might be something interesting for us to work on with emergency management on Maui. We've been having a lot of, we've been collaborating with them on regarding different outreach events and, you know, seeing what's important in terms of, you know, evacuating seniors, what kind of challenges or barriers that they have. So this could be part of this, that survey too, you know, just identifying, you know, what their experience was like during this last, you know, notification / evacuation.
Yeah, I mean, I think that sometimes we, this would be a really good opportunity to find out, you know, what the actual experience was when we were presented with a real situation as opposed to a hypothetical kind of situation. I just think again, I see it as an opportunity to learn a lot.
So if the counties are doing something like that within the next few weeks, could you include that in your PABIA report next month? I mean, because that would be good if your counties are meeting, you know, with the others to find out and doing some kind of a survey. And because, you know, it is, you kind of wonder how well it does work together. And, you know, hearing all of this, I mean, definitely everybody has a story just in this room. But can you imagine if you had nobody with you? And I would think about Sarah's friend the same way. Yeah. Okay. But thank you, Steve. Very good question. Okay.
Well, I also wanted to add, I'm sorry, that our Commission on Persons with Disabilities recently drafted a letter, sent it to the mayor with their recommendations for emergency preparedness. And one of them was to, you know, to have these emergency preparedness drills countywide or some kind of exercise to identify what our vulnerabilities are and where our you know, our where we lack capacity so that we can see where these issues are and address them. I don't think we exercise or practice evacuations enough to understand what the challenges and barriers are. We can assume, we assume a lot, but if we don't practice it and see, okay, I need to come up with plan B or enact plan C, then you know, you're always going to be stuck in that mindset that, you know, whatever I plan out is going to be the best option and you don't have any backups to rely on. So yeah, those are things that our commission brought up too.
Thank you.
And
Any
those would
follow-up,
be,
Sarah?
yeah, those would be really good to share with the general public. Because it may be that your family doesn't need to be evacuated. You don't need
Correct.
to leave the workspace.
Things that were not thought of that
Right.
day. The thing was just,
Right.
you need to evacuate, you need to do this. I mean, you know, all these different things has an afterthought was, hey, if I'm way inland and that's where I work, but yet I live way out in Waianae or something, hey, I don't need to be on the road, I
No.
can just stay at my workplace.
That's right.
But you know, that was not all in the discussions that we came
No,
up with, so
No.
I think has afterthoughts, like,
Mhm.
you know, getting this kind of data after. I mean, if you folks are meeting with your partners, that'd be good information to have for our
Right.
next meeting.
Right.
Okay,
I-
Emily?
I think
Emily?
the challenge that what we so far have debriefed and summarized from that, the challenge becomes, it's so individualized, right? It depends, right? So yeah, like, just a quick example, it's like our managing director gave the directive of going home because she want our employees safe to get to that. Then we have to, as an agency, make sure our consumers, right? So then it's like, but then part of the problem or brainstorming was, if you're talking about evacuation, is some of our employees lived over an area where we had to drive over the bridge to make sure. So it's not really a one size fit all plan, is what I'm trying to say. There's a
No.
lot of like branching off of a lot of these scenarios.
Right.
So we're realizing this, I think the hard part is not having a general plan, but then also taking into consideration all these little,
Right.
things.
Right,
So-
and that's where we get all the adults who live in Hawaii to think about it with their plan, with their family. You know, under these circumstances, what are the choices? What are our plans? A, B, C.
Yes.
You know, and get families or communities
Yeah.
to figure this out.
Yeah, yeah.
And
Plus,
you know,
Families, I mean, people needed to go home to their children. They
Right.
could not,
Exactly,
they
that's
could
what-
not.
Or they wanted
stay
to be
in place.
together.
They
Yeah.
wanted to be together.
correct.
But on the other hand, maybe the kids don't need to go, you know,
Well,
if it
they
happens during
evacuated
school,
Camp
maybe they can
Erdman.
stay at school.
And brought all those kids to
Yeah.
to Mililani. They
Right.
said, don't go out and get them. So
Right.
there are alternatives, what
Mm-hmm.
you can do with kids that would be left alone at
Mhm.
home. I
Right.
think that was a big concern.
You know, or the kapuna,
Yeah.
Or the kapuna.
or the kapuna.
So we did a lot with our,
Thank you.
our caregivers when I was operation manager for in-home care. And the basic arrangement was, is that the caregiver, you're gonna stay with your kapuna, and your family needs to understand that. And you come up with an arrangement as to where they need to be. And there's many kinds of emergencies, from big missile alerts to tsunamis.
Right.
But in Seattle, our main issue was, there were volcanoes that were ready to go, so that was one, but we had earthquakes. And earthquakes happened, and the bottom line is, with an earthquake, you shelter in place, you
Right.
don't go running out,
Yeah.
you don't clog up the roads. You don't pick up your phone and start calling, everybody there's some things that people need to, and I'm gonna go all the way back. All the way back as a foreman, as much as we train folks, so as a foreman, we were well trained. And we knew what to do, but as a foreman, but the basic person, it's so hard to train. So I look around, I just did, and I mentioned this here before, there's no evacuation, no
Sorry,
apps
there's
or
no-
anything anywhere. Most states that I've lived, Minnesota, Oregon, Washington, that's mandatory. We can't even pass an audit if we don't have the signs up there with exactly what to do.
It is actually,
It is actually in a building of the NFPA. It is part, but there's no enforcement on it.
Well, and then
And
I
that's
used
one of
to
the
do
struggles of the fire department.
I was the safety coordinator for Seattle Mental Health, so we served 20,000 clients, and we had 27 offices around King County. We would run drills all the time. And when it really got scary with like active shooter stuff, we started doing those. And I quickly learned, because it's mental health, if someone is really anxious, don't have them come in that day.
No, yeah,
No, it's not gonna go well.
Not gonna go well.
Yeah,
That's so
and then
true.
we had like psychiatrists that they were not going to stop seeing. So they're gonna do all the wrong things, and we did have actual stuff happen. And they didn't respond the way they needed to, even with all the preparation, but it's important to, so when I saw on the news, I said this earlier. When I was watching and I saw Ala Moana with all the cars backed up, and I was thinking, oh my God, it's gonna get like an hour, look at all these cars, right? So that might not be the best thing to do, and I
We're
wondered
going
if
along
we
the
should.
ocean, right?
Well, and then sheltering in place, so they also weren't very good, it was really late into the evening before the mayor said, if you're.
Well, about
four
fourth
stories,
floor, yeah.
Really need to put that out a lot earlier.
And I think, we can hem and haw about it all, and I think county leaders have looked at it, and I think there will be some changes. I mean, it was something that was unexpected for everybody, but it was a wake-up call, let me put it that way. It was a wake-up call, And the positive part is
Yeah.
that there was unification amongst all counties.
Yes.
So,
So that was
that-
this emergency.
okay, so
Lahaina,
now.
Lahaina was my
okay,
father-in-law's
okay,
family,
so-
and what they went through
okay,
there, we're
right.
still hearing those stories.
Correct, and so I think, okay, so going on,
Yeah.
okay, thank you all very much for all your suggestions and thank you execs, okay? Kapuna caucus is gonna start at 2:00, they are by Zoom. Next, please note, next month's Pavia meeting is going to be on Wednesday, September 10th. Legislative and PPRC will meet at 9:30, Pavia will meet at noon. Okay? There is nothing else on our agenda. This meeting stands adjourned at 1:30 PM. Thank you, everyone, and have a great day.
Thank you.
And happy August.
Okay, bye.
Thank you, bye-bye.
Thank you.